Okay.
So this is recording.
Recording on that. I have to record in 3 sources here, and this, and video.
So you talk to him, and as soon as when you talk, boom. Boom.
Perfect. Okay. We'll do a clap for sync. All right, here we go. Welcome to Cosmetic Networks Live, where we explore Take 2. Welcome to Cosmetic Networks Live, where we explore the cosmetic and aesthetic industry from the inside out. I'm your host, Kieran Foley, and this is episode number 20, recorded Friday, July 19th, 2013. On today's show...
Sorry, Kieran.
What happened?
I forgot to push the record button.
Okay.
Sorry.
No problem.
Take 3.
Wait a second. I'm gonna...
Hello, my baby. Hello, my dog.
It's intermission time. We need popcorn over
That's
here.
right.
Here comes the popcorn.
and also, you know, I think I'm an amateur right here.
That's all right. Let's just have fun with it.
It's all good.
Okay.
Well, the lay person will have fun with it.
Yeah.
So
That's right.
you want to make them feel relaxed while I'm talking to them, so they don't feel that I'm talking down to them.
Okay, let me make sure. Yeah, everything's good.
You good? Okay, great. Take 2, take 3. Welcome to Cosmetic Networks Live, where we explore the cosmetic and aesthetic industry from the inside out. I'm your host, Kieran Foley, and this is episode number 20, recorded Friday, July 19th, 2013. On today's show, we're really pleased to have Dr. Tim Delaney join us. Dr. Delaney, welcome.
Thank you.
So before we get into the topic of the day, which is going to be talking a little bit about overall health of teeth and also something relating to TMJ, or the temporomandibular joint, let's talk a little bit about how you got into the practice of dentistry.
I got into the practice of dentistry because it allowed me to change a lot of things for people. It changes their attitude by getting into cosmetic dentistry, by changing their appearance. Can we start that over?
Yeah, sure, absolutely. Go for it. We can edit it out. Don't worry.
You want
no problem.
That's the first one. I was on the technical. I was looking at all the technical. I got to think back how I got into it. I was a little boy.
Yeah. You know, Kieran, you didn't.
What did I don't know. Probably my orthodontist, I guess. Now that I think back.
Oh, we can talk about what.
Let's walk this through. Like, what do you want to? I thought introduction. We talk about his like a hobby and stuff, right?
Just a little background. Yeah. You know, what is it that you enjoy the most about dentistry? I suppose could be a good question. And then.
Okay. Yeah, that's a good question.
And then. Yeah. What is that? Yeah. We didn't actually, when we did a pre-interview, we did pretty much his background. So.
Gotcha. Okay. And then maybe we could talk about the surfing too. That would be pretty cool. It sounds like.
Yeah. Great.
Yeah. So, and then we'll get right into the topics then. So.
No, that's fine. I just didn't know what direction we're going.
Sure.
I was a little boy in the sofa, you know.
All right, we'll do a full take. Here we go. Welcome to Cosmetic Networks Live, where we explore the cosmetic and aesthetic industry from the inside out. I'm your host, Kieran Foley, and this is episode number 20, recorded July 19th, 2013. On today's show, we're delighted to have Dr. Tim Delaney joining us. Dr. Delaney, welcome.
Thank you.
Terrific. So before we get into our topic of the day, which is going to be centering around TMJ and general tooth health, I wanted to ask you, what is it that you enjoy the most about your profession?
It allows me the opportunity to change someone's appearance, change their life in the way that they could have more self-esteem, be more comfortable with themselves in the public. We change a lot of things in the cosmetic industry of the teeth, and what it does is it gives them a more confidence level when they're out talking to people.
Now, speaking of confidence, I understand also, as part of our shows, we do a bit of a pre-interview. So we learned that you actually enjoy surfing, but you're an avid surfer, as I understand it. Is that right?
Yes, I've spent most of my life surfing. I started when I was 10 years old. I've traveled the world doing it, did some competitive surfing, and still today I take trips around the world looking for the best waves.
That sounds exciting. So getting into our topic, today many people are having their teeth cosmetically altered, but Is it generally your opinion that people have very little knowledge about the importance of functional bite? In other words, they may be concentrating a little bit on getting their teeth whitened, but may not be concentrating on their bite as much. Can you talk to us a little bit about what is TMD and why is it important?
When a person comes in, a lot of times when they're seeking cosmetic dentistry, they're looking to change something in their appearance. Well, when we do that, and if it's a comprehensive approach, some of the things that they want are going to change the dynamics. That is, the way their teeth function. And if that's not addressed in the beginning by making sure we have a healthy system that's operating and supporting that dentition, things can be complicated. They may get the result, but they may be unhappy with how things feel after.
I had a friend in high school who actually had something called TMJ, and she complained constantly about sort of clicking in her jaw and difficulty chewing. Is that what you're referring to?
Yeah, a lot of people may have a condition before, and if we go ahead and change the way they function because of what their desire is, we can make that system fail. And that causes them a lot of craniofacial pain, headaches, neck aches, back aches, and it can really interfere with their life. And
is this just something you get? Is this something you're born with, or can it be caused by external factors, eating the wrong foods, or maybe sleeping the wrong way?
You can be born with defects that put you in a predisposition of having the TMD, or temporomandibular dysfunction, as we call it, become more problematic. A lot of it can be habitual. So there usually is a baseline on different people on how susceptible they are to having a increase in the problem or just having it stay as status quo.
And what's actually happening when you're getting symptoms? I mean, is it just a misalignment of the jaw with the bones of the skull, or what's actually happening in there? Is it grating against, or bones grating against each other, or?
The temporomandibular joint, there's actually two of them, right and left. So it's one of the only systems in the body that has two joints connected together. And because of that, it makes it one of the most complex. It's also connected to a lot of muscles. Those muscles control the function of a disc that will slide in between the actual joint. And if that disc is displaced, damaged, we can get bone to bone, which can cause certain symptoms. We can also get the disc displacing into the side or forward, driving the actual joint against the socket, and that can cause other problems neurologically by impinging on the nerve system that actually sits right in front of the ear.
And do you see symptoms evolving across all age ranges and all genders, or is it specific to certain types of people?
I have patients that suffer from TMD as young as 10, 12. As they're going through ortho, we can correct some of those problems. Most people have gone undiagnosed for years, and what has happened is that they've actually exacerbated the situation. A lot of TMD symptoms aren't recognized, like I said before, with back pain, neck pain, and people are very tolerable of these things until something finally collapses.
Wow, wow. And does TMJ management play a major role in then the cosmetic end of things, in cosmetics dental procedures?
It does in my practice. One of the first things we do before someone wants to do a reconstruction or change their entire look is evaluate what the actual supporting systems are and what their conditions are and what they're doing and how they're functioning. We have some new technologies that allow us to actually do that and see things we couldn't see before. So by analyzing that first, we know that we have a good starting point.
And is it dangerous for me to go ahead and get certain cosmetic procedures without having an underlying joint issue addressed?
There are certain risks. You can't really treat or manage what you can't see. And so if there isn't a proper evaluation of that and you get extensive dentistry, there is a good chance that a problem could surface that was otherwise quiet.
And how do you differentiate TMD from other ailments? Say I'm a teeth grinder or whatever, or I just have fatigue. Talk to us a little bit about the diagnosis process and how you determine someone has this.
Well, the first step in diagnosis is if the patient has symptoms. You can look at the dentition. You can see habitual wear. An interview process, an education process with the patient is important. TMD is something that we have to treat the patient for. We don't necessarily always see it. A lot of my patients are actually asymptomatic. They don't feel anything. But as I look at their dentition and look at how they function, asymmetries in their mandible and the way that they move, I can tell that they do have a problem that may be underlying.
Interesting. And what equipment do you use, or what process do you use when you talk about the alignment of the dentition? Is it just a visual inspection? Do you take x-rays or casts or anything?
A visual is fine, but we're not able to see a lot of these things. And in the past few years, there's been some really significant advances in how we data collect information. So we get to see more things now. One of the things we use is a CT scan, which will show us the basic hard structures. If you go and break your leg, or we are able to see where the fracture is, where the deformity is, and that gives us just the basic starting point. But more on the forefront now has come in what's a joint vibration analysis. It's a system that the patient wears. It takes about 30 to 45 minutes to do. And what we do is we're actually able to use sound waves and vibrations to analyze what is actually going on mechanically as the patient is opening and closing.
Wow.
It actually gives us a computer read, and we can indicate how severe, what the situation is, and therefore directing us to what kind of treatment this person needs.
That's fascinating. And speaking of treatment, what is a course of treatment for particular sufferers? And I imagine there are probably a range of treatments based upon the severity, no?
The different treatments are geared toward what we see on the joint vibration analysis, and if we have actually remodeling or deformity in the hard structures. We use a lot of splint therapy, and it depends on how that splint is actually fabricated, which will direct us to decompress that joint and allow healing to occur. What's amazing is our body can actually heal a lot of things, as if you were to break a leg and wear a cast. You can't take that cast off in the morning, go to work, come back and put it on. You're not going to get a significant healing of that leg. Same thing with the joint. We are actually able to decompress that joint. Must be worn at all times, which sometimes takes a lot of compliance with the patient, and that's a difficult barrier for them to get over. Most of the patients that I have treated have been, once they see the results, they start to comply more, the ones that are a little more resistant, and we get that healing process beginning.
And what is this splint? Is it something you wear on externally, or is it internal and external? Or?
What we do is we use 3 different types usually. We have a initial one which will be called a pivot, and it's where we actually have you bite the cusps of the teeth. They're only biting on the back. It's a lower appliance that you wear. It does impede the speech a little bit, but people get used to that. And what happens is when you bite down, it actually decompresses and pulls the mandible down and forward, therefore letting blood flow come in there and let the healing and repairing start. The other one that we have is when you wear during daytime, and that's the one you're going to function in most of the time. 24/7, you eat with it. Occasionally we'll have people sleep with it, but a lot of times we'll put people into a nighttime appliance. It's a little more comfortable and compatible with sleep.
Fascinating, fascinating. So now we've come to the point of our program called Rapid Fire Q&A, and this is where I'm going to fire over the fence to you about 5 questions, and if you can answer these as succinctly as possible, that'd be great. So, number 1, if you're ready, is what is CAD/CAM dentistry?
CAD/CAM dentistry is where we're able to fabricate a restoration, or basically a crown, do a lot of cosmetic dentistry on the computer. It allows us to manipulate things and then actually have the equipment mill out the restoration.
All right. And number 2 is, can I have veneers done if I'm a grinder?
You can. It goes back to the point of having the mechanics, the dynamic function be compatible so that we have control of what's the malocclusion or the bad forces that are placed on veneers. Veneers are just a surface placed on the surface of the teeth, so technically the dentition should stay the same, but it's when we go outside those parameters of function, which is what goes back to the original question, where people want to have their teeth longer, wider. If they're ground down, they want them to have the curvature different. Some of those requests take us outside those parameters of function, and their normal daily habits will break those veneers.
And number 3 is, typically, how long do porcelain veneers last?
That's a difficult question to answer because everyone's going to have different habits and use their teeth in different ways, so to speak. We like to see veneers last anywhere from 10, 15 years. A lot of times it's less than that, depending on if there is bad habits being performed on them.
Great. And number 4 is, what are the top 3 things one should avoid after having veneers done?
I would say to stay away from chewing ice, things like that. A lot of common sense stuff. You know, you can go ahead and have normal meals and everything like that, but you need to be aware of the typical habits a lot of people have. They'll use their teeth to open things, you know, things like that. So a lot of common sense is involved in what you do with your veneers. We need to remember, too, those habits will also break natural teeth. A lot of times I'm placing veneers because someone has already tried to open a package with their teeth, or they have chewed ice.
And number 5 is, what are the 3 things one can do to make the teeth bleaching effect last longer?
Bleaching is basically, or teeth whitening, I prefer to call it, is actually where the material is removing stain from the enamel. So things like coffee, things like tea, things that will actually stain a cup. If you leave your teacup in the sink and take a look at it the next day, the stain is able to penetrate. So it's about keeping the limited amount of time of things that can stain, like wine and tea. And my suggestion to my patients is usually have a little water after, dilute it instead of letting, you know, having that red wine and letting it just stay on the teeth contact for so long.
Great, great. Well, this has been fascinating. We're coming to the end of our program, but I wanted to thank you for coming on today and sharing your expertise with us. It's really, really interesting, and I'm sure we'll have you back again to tell us more about the field of cosmetic dentistry and dentistry in general, which is a very, very large field with a lot of moving parts. If someone has a question about your practice or wants to reach out to you right now, how can they best get in touch with you?
My practice is in Newport Beach. It's at 1401 Avocado. I'm in Suite 502. The phone number is 949-640-9554. And I look forward to hearing from anybody.
Great, great. Well, listen, it's been a pleasure talking to you. And again, for our viewers out there who want to learn more about Dr. Delaney's practice or any of the doctors we feature on Cosmetic Networks, go ahead and visit us on the web at cosmeticnetworks.com. And for now and until next week, I'm Kieran Foley. I'll see you next time. Great. Great job.
Great.
Thank you. Did it feel okay? Yeah. Yep. As long as Dr. Leon pressed the record button, we're okay.
Let me see. Hold on a second. You just made me nervous. Okay, no.
I can do it again.
No, you did great.
Yeah, I think it was great. Like it was short and precise, you know.
Yeah. This one felt a little shorter. There were only, you know, there's some pretty focused questions in there, but I think we have about looks like 16, maybe 17 minutes, something like that. So, but we'll come back. It's good.
Detail, but no, I think you know, it's an ongoing process. Like like himself, he just told me I got so many topics, you know.